time. And I get a roll call. Stacy Kali'inoi.
Here.
Bill Wakayaki here. Blum.
Here.
Delchi.
Here.
And would you guys like to introduce yourself? Because I don't think I know all you guys.
I'm Chrissy Hoagland, the Executive Officer for the PT Board.
Okay, you're the executive officer.
I'm Jordan Ching, I'm the Deputy Attorney General assigned to this board.
David Winber, Administrative Assistant.
Okay, awesome. Well, it's nice to meet you guys. I think we met you.
Yeah.
I think I was virtual last time, so I kind of don't remember everybody. So do we have any guests today?
Three.
Members of
Three members of the public.
Oh, awesome. Okay, first thing is the approval of the minutes of our last meeting in February 2026. Did everyone get an opportunity to review both the open session and the executive session meeting minutes? They were emailed prior, and then you've got it for you. Any discussion or someone make a motion?
I make a motion to approve, but there's error. We gotta amend it under new business.
Of the open?
The open one.
New business.
New business, the delegate and alternate delegate. Says, appoint Ms. Wakabayashi as delegate and Cindy Tamayo as alternate. It's swapped.
Mhm.
Cindy is delegate and I'm alternate.
I will make that update.
Yeah, that's the only change.
Slide.
I think that's how it got mistaken with FSBPT for that.
Yeah.
I was like,
probably. Any other items people need to bring forward? Otherwise, we have a motion on the floor with the amendment correction.
And I can second the motion to accept the minutes with the correction.
Okay, I guess I'll take a poll since Michelle's on. All in favor, Michelle, you good? Okay. Ross,
Good.
Jill,
good.
Stacy,
Aye. Good.
and I'm great with these. So thank you. The minutes with the amendments change is approved. Moving on to the continuing competence course for review.
I'm sorry, just for my clarification, that was both the open session and executive session.
Yes. We need to move into executive session over the question. I was a little confused because one of the,
So there's one for review and there's the rest are just for ratification. I don't know if you need to go into executive session for this one. This is the one that you.
right. I just had some questions about something we haven't established, so I don't know if we need to go into executive
It just
session.
depends. If your questions are legal questions that require my advice, then yes, but we can go into, you can go into executive, but if it's just for board discussion, then open sessions.
Know that it's legal.
Yeah, so maybe for now, we'll just stay in
Yeah.
open session.
So, okay, we can discuss the masterclass workshop that we have. I'm sorry, again?
Looks like the speaker is here.
Oh, Jonathan Nguyen. My only question on this is, my previous knowledge of other boards was that a representative of a company, like a vendor, cannot submit for CE because of a kind of like a conflict of interest or whatever. I know like medical boards and things like that, because I've tried to get courses before and they said, oh, no, they can't because they represent the company, whatever. So that was my only question, since Jonathan works for the company and is representing that product. But it is.
Sorry, Chair. Jonathan does have his hand up if you
Oh.
wanted to.
Yes, that would be great. If we could hear from Jonathan, that would be awesome.
Okay, I'm gonna unmute him.
So,
Okay. Aloha, yes. Thank you for having me be part of this, and I'm happy to answer that question. So as far as yes, I am a PTA. I do work for the medical manufacturing company Medi USA, who hosted the workshop. It's a Medi Masterclass. We actually have a certification for CEUs through the ABC and BOC compression fitting boards, which is typically for compression fitters that would work in like a DME space. And in most other states, I think all but one really, they reciprocate those credits because it already is approved on the national level for the fitter boards. And so this is not necessarily um, requesting that Hawaii approve it from the PT board perspective. If you want to, that'd be wonderful, and I would appreciate that. Obviously, makes it very easy for the therapist to get the credit. But most other states don't have to ratify it as a continuing education course and use it in that regard. It's more of acknowledging that it is accredited through a separate board entity. That way, the therapists who attended or the clinicians who attended can get either a reciprocal credit or partial credit or however you deem worthy for that.
Good question. So its course fee amount is zero. Is it because this is only for Rehab Hospital of the Pacific employees?
No, it was hosted by them, but there were other facilities. I think we had one or two from Maui, and I think maybe one from Big Island. The rest were from local on Oahu. But that they were just gracious enough to host the workshop. Normally, when I host these, like I'm in Milwaukee right now, I cover Chicago, Dallas. I fly around most of the Western U.S. to put on these workshops and training opportunities.
Oops, lost.
This phone number. We can do.
How was that?
Oh, he's back.
If it was a general course, I don't know. I guess it's, yeah. And I just know in the past, and I looked again to see if medical boards still don't.
It's because of the products, right?
Yeah, so like the D
Okay,
is.
thank you. Yes, sorry, I don't know what happened on the connection there.
Event 550.
So yeah, so there's focus. We talk about diagnosing the different like stages of lymphedema, lipedema, and then matching the product to that stage of the diagnosis. We have to recognize what condition you're looking at. Is it CVI? Is it lymphedema? Is it, a combination of different things, or CHF, which then we wouldn't want to use compression on a patient that has unchecked, congestive heart failure that they're not being followed by a cardiologist, because then that would be bad. So we do talk about some of the scientific implications of coordinating differential diagnosis with matching product associated with that. And so there is part of that in there. So it's not all product, but there is definitely product mentioned. And then we go over, our standard of measuring for custom garments. Not everybody fits in ready to wear. So we did talk a little bit about that in the workshop, which is pretty much industry standard in terms of compression, as far as like our matching landmarks, how to fill out the order form, things like that. So again, this is typically a class that's guaranteed credits by the fitter boards, because usually the DME space is where those fitters live and work. Not all PTs have access to a local DME, although there are some growing number on the various islands. But that is the reciprocal accreditation. So even if I know we had quite a few attendees in our workshop, and I understand if there are some hesitations about product being mentioned in the course. I'm a PTA myself. I understand how the CEU process has to work for my own licensure and things like that. But for those who did attend, at least offering the reciprocation of those credits would be I guess, the request.
I have a question.
Yes.
Is this class exactly the same schedule and certificate and the things submitted? Is this already approved by another state for this cycle, this 2025-24 cycle of renewal?
Oh, yes, definitely.
And
Yes.
approved by a PT board in another state?
As far as approved by a PT board, no, to my knowledge, because I know we operate mostly with the fitter boards, which are from the DME side. But that accreditation is definitely upheld, and I know that other therapists I'm based out of Phoenix, so I did one of these workshops in the spring in Scottsdale. Nobody has had any issues getting reciprocal credits through their AZ, PT board. Even though it's a fitter certified course, they're getting basically a reciprocal credit. And then I've also done this in Illinois. I've done this in Texas. Nobody has come back and said, oh, well, the PT board didn't approve reciprocation of the CEUs because it was already approved by the ABC or BOC accreditation capabilities.
Jonathan, I have another question. So under 14D,
Mhm.
the flat knit compression, so that's where it has like product.
Yeah.
During the class, did you give alternative? Because we are in Hawaii, and are there alternative garments they could use instead of this, or would the client have to specifically be given this one and order extra or whatever? Were they allowed
So
to do?
the patient is always free to choose, as with any medical patient bill of rights. So nothing is forced on anybody. It's just, as you know, there are several, car manufacturers like Ford and Chevy and Toyota. So if, you go to a dealership and ask for a Toyota pickup, they're not going to show you a Ford Escape, right? So it is brand specific as far as what I'm able to speak to or to teach on problem solving or, matching our product with this type of condition compared to a competitor brand for compression, so to speak. I'm not going to be able to recommend a competitor's product, but it's not to say that the therapist or the fitter can't choose it just because they came to our class. They're definitely welcome to work with those other reps, those other manufacturers. There's no exclusivity. It's just I can only speak to our company's product and techniques, etc.
Okay. Ross, did you have any questions?
No.
Michelle? You have any questions?
I do have the same concern about being product specific. I also don't see the designated time for each, how you're getting the denomination of Cs that you're requesting.
I can definitely pass on the ABC BOC outline that has the minutes breakdown for the workshop. And that's how they give their accreditation, is based on how much is business versus science, explanation of differential diagnosis or product specific, techniques and features benefits. So would that be helpful to have like the ABC BOC breakdown for that outline?
11 o'clock.
I think so, yes.
Okay. I'm on this call from my phone. Once I pull up my laptop, I can definitely send that over. I have the DCCA email from the invitation. Is that an acceptable email to forward that to?
Yes.
Okay. I can take care of that today.
Thank you,
Thank you,
Jonathan.
Jonathan.
I've taken a course myself about burn garments, and I know how limited our vendors and how much shipping and things and issues coming to Hawaii. So I understand having a
Mhm.
product that course, I'm wanting to include that in the education, but I think all of us on
Mhm.
sort of a gray area feel like there is a portion of even your test is very good with its questions about lymphedema and staging and compression. And if we could sort out 25% of my presentation is product placement and 75% is teaching about lymphedema and staging and compression, then I would really like to give credit for that 75% that I think is really educating the population about what to do. And then there's a product that really will work for your population. Here it is. I feel like those are two different things, but we absolutely want to give the PTs who attended this the credit for the part that it was education on lymphedema and lymphedema management. I think that's my summary of how I feel about it. And your breakdown is going to really help us figure out what the CEUs should be. And I think that that could be easily approved by myself, not speaking for everybody, but then we can discuss it further. So thank you for being a part of the discussion. I think I understand it better now.
Yeah, I agree with Stacy. I
Okay,
think
great.
what's important is to know how much of your course was general knowledge versus specific to your garment. Because the part that's specific to your garment, I have issue giving credit for, but the general knowledge I think is very valuable. So if there's a way to delineate that, that would be awesome. But what you're actually asking or kind of your request is that because BOC and ABC and the fitters have approved this for CEU or CCU, you want us to consider reciprocation of theirs, not necessarily create our own approval of your.
And that's pretty much how it works in the other states because for whatever reason, the fitter boards are national entities and each state has, as you know, its own. So we'd have to go with each state every year and, reapply changes and things like that, which, and there's lots of research changes and things that come out every year for all courses. But because the fitters have that national certification, it tends to be a little bit easier for us to maintain that and then let the states decide independently. We agree with what the ABC BOC said, or we want to give partial credit like you guys are suggesting, and we can leave it to each state to make that decision. But that is generally what happens in Wisconsin or Nevada or California, etc.
Gotcha. Thank you so much for the clarification. Yeah, if you can send that breakdown, it would be helpful.
Okay. Yep, I'll pull up my computer. I can send it over here shortly.
Okay, thank you. Did you have any other questions, Jonathan?
No, not from me.
Okay.
All right. But
so we'll defer the decision on this for a little more information from Jonathan when you get your computer and next meeting.
Yeah.
Thank you. Okay, now we can move on to the ones that have already been reviewed. We have the upper body seminar, integrated manual therapy for shoulder conditions, cervical conditions, and forearm, hand, wrist. Manual lymph drainage NLD certification for 45 credits. Brain 1, brain tissue, nuclei, fluid, and autonomic nervous system for 24 units. Visual dysfunction after concussion, 1 unit. Fascia, 11 units. Lymphatic drainage therapy 2, 24. Lymphatic drainage 3, 24. Photobiomodulation in evidence-based practice for 1. That's a lot of words for 1 credit. Integrating MPKs into physical therapy practice 2. ACVIS certified brain injury specialist training for 15. Evidence-based respiratory muscle testing for 6. And this was the master's class workshop. We are not approving those units. Yeah, we're holding on that. Was there any discussion? It's perhaps been a while since whoever reviewed these, and I think I reviewed some of these, but it's been a while. Does anybody have anything they want to say about courses that they reviewed?
I think I had the lymphedema drainage therapy 2 and 3. It was very detailed, very specific, so that you could count the hours and the credits. So I thought it was well done.
Manual lymph drainage is 45 units. That's a lot.
Yeah.
Compared to that.
Now there's, I guess lymph stuff was big during this cycle.
I think so. Well, I think we're getting more patients now, probably.
Yeah. Okay, any other discussion on these programs for approval short of the masterclass workshop? I move to approve these courses.
Second.
It's been approved and seconded. Michelle? You approve?
Approved.
Thumbs up? Ross, thumbs up? Jill?
Yes.
And I approve. Okay, awesome. We're gonna move on to item 4. Do you want to do that looks like we want to do the ones, this very long list first? And then we'll go into executive session to discuss the. Okay, why don't we look at the ones that are on the 1, 2, 3 page. I can still count it. That is a long list.
Oh, and you're into the 6,000s for
Yeah.
PTs. Wow.
Hi, Stacy. Kelly, I'd like to make a motion to approve this list of PT and PT assistants for licensure in Hawaii.
Ross second list.
Great.
So maybe before we vote, we should just ask if there's any public testimony on this.
Okay.
Yeah.
Awesome. Does anyone have public testimony on the list? I don't know, page, I think 3 through 5 or so. Long list of PTA, PT candidates.
I do not have any public testimony at this time, Chair.
Great, thank you. Okay, and we can move on to a vote. Yes. Yes. Michelle, are you good with this list? Ross?
Yep.
Jill?
Yes.
Stacy? And I'll approve. Okay, now we can go into executive session to discuss the application for Mr. Polycarpio.
I Jill move,
Yeah.
I Jill move to executive session for discussion of the application.
And so maybe I'll just, I noticed that, item 5, I don't
There's
know,
another one too, yeah.
yeah, I don't know
Where's Puffy?
if you do want to, just so that we're going in and out.
Yeah, do all of them?
And maybe just say if you want to go to executive sessions for both, item 4B and item 5, if that's for the board.
Yeah, I think that would be best.
4B and 5.
Second?
Second.
Okay. Anyone opposed? Jill, the chill. Michelle, you're good? Go into executive session. Does she have to go out and,
I think they're gonna direct her.
We put it back in.
okay, into a private chat room? Okay, Ross, you're good.
Yes, yes.
Stacy, and I'm good. Okay, we'll go into executive session. Thank you. Okay, well, welcome back to the open session. During the executive session, we discussed items 4B and 5A, B, and C. So we'll move on with the consideration of 4B, the licensing for Rizal Policarpio. I'll call for a motion to approve or a request for a exception to the FSBT ruling on her sitting for the licensing exam. Do we have
I
a second?
second the approval to sit for a 7th PT licensing exam.
Now we will take a vote on that, okay? All right, Michelle, you'll start us out.
I don't approve.
You vote against approval? Ross?
I vote to approve, to allow her to take the tests one more time.
Does that need to state? It says it in the rules. Okay, Jill?
I approve to give her the appeal for one more exam following the FSBPT requirements.
Yes, I approve.
Yeah. I'll also approve the appeal for sitting for one more exam. Do we need more testimony?
Oh, you can just, maybe I should ask if there's any more public tests.
Is there any more public testimony on this item?
I do not have any public testimony at this time, Chair.
Okay, so we do have a quorum
Yes.
that is
Yeah.
approving the appeal to sit for one more licensing NPTE exam offering for Ms. Policarpio.
So then that letter comes out of your office to FSBPT.
I'll fill out the rest of that and.
Oh,
submit
okay.
it to
Oh,
them.
there's a form. Okay.
And now we'll move on to the new business in 5. The first item is the scope of practice inquiry by Rico for shockwave therapy extracorporeal, I can't even say the word, radial shockwave therapy as a physical therapy intervention.
Could I make a motion to state from the Hawaii PT Board that you do not specifically need a PT licensure to administer this shockwave therapy?
I'll second.
Any discussion? Okay, then we'll poll for vote. Michelle?
I approve.
Ross?
Yep.
Jill?
I approve.
Yes.
And I'll approve as well. And do we have any public testimony? I probably
Oh,
should
you can
ask.
ask, yeah, you can ask.
Yeah. Public testimony on this? Is there any public there anymore?
We do not have any more public people at this time.
Each time?
Yeah, maybe just ask, is there any more public testimony for all the items in 5, just so the record's clear.
Okay. Any discussion on items A, B, or C in section 5?
Yeah.
Seeing none, Chair.
Okay. All right, the next one was a discussion regarding continuing competence units for physical therapist assistants. And the board will continue to inquire on this particular item, as well as the discussion regarding participation in Federation of State Boards of Physical Therapy Exam Licensure and Disciplinary Database, ELDD, data sharing. This will also be an item that we will continue to perhaps learn more about and explore for future consideration. Okay, we don't need a, okay, executive officers report.
Your packet. I've just included, this is the ethical courseware that was offered. It's just some data about the course that they finished at the end of the year. And the other one is just information that's provided by people who take the MPPE. They ask a survey whether or not people are satisfied with licensure process and a few other things, which I've included for you.
And I don't want to sound, or unawares, but I didn't know we had a Hawaii Jam. I know FSBPT, they have, and they definitely promoted, but I didn't realize we had a specific one.
Yeah, well, because when I was originally on the board, I know that Debbie helped write questions for the jam, and she also used those questions as the first ethical exam that people had to take. But I didn't know we implemented it, like they could take it as their alternative for because we were trying back then to only require the jam to be the ethical exam so that all these other companies that have been applying, we don't have to look at it like they can't submit.
Yeah, that's why I was surprised because
Yeah, so when
why
this
would we
came up-
approve other courses if we have a standard, if you would? I didn't know. And when I go to every FSBPT meeting, they talk about the jam and really
Everybody does
promoting
the
it. And I'm like,
jam.
oh, that would be great. I think we should have it. And I didn't realize we had it. So if we don't know it, did you know? You did? No?
So when you renewed your license, you didn't take the jam, you took
I
another.
took the one on Medbridge because I have a
I think the advantage.
advantage. I've taken that one before too.
I think in the last 10 years, there's just other, like you said, there are other options.
They're less expensive for.
I don't think that any PT says I should take the Hawaii specific one.
Yeah.
I think it's whatever your coworkers told you about, the one you took for the last 15 years, you know. And then in this, it talks about funding for it. They might consider not funding for it because they're tracking who's taking it and whether or not it's worth their kind of time. And I don't know that the one that I've been taking for the last 10 years isn't adequate for my ethics. But like you said, when this was created a decade ago, there was an intentionality to it, but it hasn't exactly been the one resource. It hasn't become the most popular, I would even say, because the amount of people who take it they're in the hundreds.
Decreasing.
Right.
Yeah.
So I don't know if the board feels like, I mean, this is good information and knowledge to have. I don't know if we're making any decisions today
No,
about
it
it.
doesn't.
I think what they're requiring, right, and then what they're
Well,
saying
this
is,
was.
if we require it, then it would of course go,
Yeah.
right? But I don't particularly need to
Yeah,
make
and
a
that's,
decision about that today.
yeah, no, and it was just kind of,
Well, I mean, with the fact, that's why if at the regulatory workshop, people were surprised when FSBPT said they might, not offer the jam to all states for free, that there might be a fee, then everybody's red flags kind of went up. Because some states, that's all they're allowed to take to renew their license, and it just ends all other private companies from submitting for continuing education credits.
When once we approve, I mean,
But
our
we didn't
credits
approve
are-
that.
we've
And
approved
we
several.
can't. I don't know, we would change it in the rule.
I think that's an option. But
Yeah.
I guess it depends on the nature of it, though.
I mean, I don't feel strongly either way, but I just was kind of surprised. I didn't realize, but I've
I
always
didn't
taken
know
it
the
elsewhere.
statistics on it. That was
Yeah.
interesting.
Yeah, for sure.
50 questions.
That's probably why people don't want to take it.
it.
Because the other ones are all like.
Am I the one who's taking the high jump? It did take a while.
Yeah, I've taken one on Medbridge because I have the subscriptions. All right, well, thank you for that information. It was interesting, for sure. The next item is the election of officers in accordance with.
Oh, sorry, can you ask, I know there's the one,
Oh.
yes, for the record.
Oh, yes. Is there any public testimony to the items under the executive office or the reports?
I do not have any public testimony at this time, Chair.
Thank you so very much.
Of course.
Now we can move on to the election of officers in accordance with HRS And 4436D, section CA. We'll elect a chair and vice chair immediately upon the qualification and appointment of the original members and annually thereafter. Oh, that's. The board shall elect one member as chair and one member as vice chair. In the absence of both the chair and vice chair to preside at the meeting, the members present shall select a chair pro tem. So we need to elect a new chair and vice chair.
You're speaking, that's public testimony.
Oh, do we have any public testimony for the election of officers?
I do not have any public testimony at this time, Chair.
Mahalo. Okay, well, do we have any nominations, I guess, for these positions?
I nominate Cindy and Stacy.
And if anybody else wants to, I don't mind.
And Michelle can be pro tem. Oh, we can make Ross.
Pro tem is done at the time,
Yeah, you don't need that.
based on who's at the meeting, yeah.
You might not even have a quorum anyway, right? If they're both gone.
Yeah, yeah, we wouldn't. Yeah. Yeah, we still have to get a public member. That's another. Two. Let's try for one. Yeah. I'm fine with continuing, but if someone else wants to step in.
Same.
The only, from my perspective, it, for me, and I don't have a problem, it is a bit difficult because I'm on the other island. To try and communicate with the staff. I mean, even, well, of course that, and I'm also working quite hard as are most of us. So that's my only issue because I feel like, because I can't come into the office and talk or whatever, I feel like sometimes things get away. So that's my only issue, but I'm fine with doing it. I'm almost getting the verbiage down. As long as there's someone to say, hey, you forgot such and such. Chris had
You're doing a great job.
Chris had to do it for many years, so. Like,
Yeah, I think you're my.
yeah. Fine with it, unless someone else. Jill, you sure you don't want to step in?
I was told years ago that I couldn't as the PTA member because it's the PT board.
I mean, I can check. I don't believe there's any specific.
Other
law
boards,
that-
even the public member is the chair.
Really?
Yeah.
We were told the public member couldn't and I couldn't
It
because
makes
it's
it
a
a little more
PT board.
complicated if it's a public member being the chair, but even a public member can be a chair, so.
Well, that's cool.
I know, because on one of my boards, the public member is the chair.
But Cindy's doing a great job.
You could be vice chair if
Yeah.
Stacy doesn't want it.
I'm okay with Ed.
Well, I'm looking at baby.
The baby.
Because knowing that you're gonna have a baby, but then I don't know, there's Michelle and Ross have been on the board.
All anyone
I-
has.
I'm new coming back to the
New,
board.
you're not new.
I'm new coming back to the board.
All anyone
Things
has
have
to say is,
changed.
yes, I would do it, and I would vote for anybody. I mean,
So
because
there's
we're such a small board.
There's no legal limitation for who.
I can be vice chair if Cindy will be chair.
Okay.
If you don't mind, Stacy.
not
I'm
at
just
all.
thinking, because having your first baby,
Well, it's high risk too, so,
Goodness, yeah.
yeah.
she's not high risk, no. We're positive.
Yeah.
Yeah, that sounds
Okay, I'll
great.
volunteer if Michelle doesn't have, if Michelle wants it.
I think you two will do a great job.
We actually enjoy going to FSBPT meetings too. so,
Yeah.
yeah.
So,
Well, but
You
still
can
sign
go.
up, though.
You can still go,
They're doing a lot of things.
maybe not
virtually.
this year.
Yes,
But
there
next
needs to be
year.
a motion and a second and then a vote for it.
Okay, yeah, we're not taking it for granted. We're just waiting for Ross to put his hand up and say he wants to do it, but.
We all did.
Okay, does someone want to make a
I'll make a
motion for us?
motion.
Do we need to do each separate or for
No,
the slate?
Or just a motion
for
and
the-
second for whoever.
I'll
you-
do a motion that Cindy Tamayo will be our chairperson and Jill Wakabayashi will be our vice chairperson.
I second that.
Michelle was very quick on
Oh, that was
that.
fast.
Okay, we'll take a vote polling. Michelle? Yes.
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 You're happy. Okay, I approve.
When this baby is 3, I'll be ready.
It goes fast.
Sign up, do virtual classes, virtual courses.
Yeah.
Virtual conference.
Yeah, you can do virtual. I'm
Yeah.
doing the July one in virtually. Okay, sorry. So the motion carries. I will continue to be the board chair and Jill will now be vice chair going forward at the next meeting. Okay, so chapter 91 adjudicatory matters, we need to.
Take a recess. You can just take a recess.
We'll go into recess to consider chapter 91 adjudicatory matters. And can somebody close the door?
Yeah, yeah.
Hello? Yes, we need to take a little break. Okay. Okay, looks like everyone's back.
You're good now. Thank you.
Okay, good. So our next meeting is scheduled for September 21. Is that a Monday?
Should be, yeah,
Yes. Okay, at 9 a.m. here,
in the Queen.
the one next door. Okay. Does anyone, you're due in?
Things could happen well before September 4th, probably on August 7th or 14th.
You could always do virtual, I guess, but
Yeah.
Well,
because we have such a small board, it's,
I know we had a little baby join us once before.
yes, we did. Yes, we did. Yeah. Or
I'm just worried that you will be okay.
Michelle, as far as you
Especially
know,
'cause
that
it's a
date
virtual
looks
option.
good because we have too many people now. I think it's fine for me too. I like Mondays. I can just stay here.
Why you wanted Mondays, well, your day off, you have Mondays. Then she can stay in for the weekend.
I'm gonna be off until January, February.
Good.
It's Yom Kippur, but
I'll go by fast.
yeah, I look, my meeting schedule doesn't look terrible, so, okay. So obviously, if something comes up in the meantime. Okay, I can call for adjournment now at 10:52. And it's great to see everyone. Michelle, I wish you were here in person, but say hi to the gang, okay?
Will do.
Shriners,
Yeah.
Got a parking pass there.
I know, I had to run and back out, so yeah.
All right, next time. Thank you. See you later.
Thank you.
Yeah, she's Shriners, you're St. Francis West.